Are you taking cyclobenzaprine for muscle pain or spasms? While this medication can be effective, it also comes with potential risks. In this video, we'll break down the most important cyclobenzaprine side effects you need to know to use it safely. If you've ever strained a muscle, you know how painful and limiting it can be. Even basic movements or daily activities may become challenging. To help manage this discomfort, healthcare providers often recommend rest, applying ice, manual therapies such as active release technique, or targeted rehabilitation exercises. In some cases, medications are also used to reduce muscle pain. Over-the-counter anti-inflammatory drugs are typically the first option. However, when additional relief is necessary, prescription muscle relaxants may be considered. These treatments are intended as short-term aids while the muscle injury heals. One of the most commonly prescribed muscle relaxants is cyclobenzaprine. This medication works within the brain and nervous system to reduce pain, decrease tenderness, and improve mobility. Cyclobenzaprine is FDA approved to relieve muscle spasms caused by acute musculoskeletal conditions. Importantly, it is intended for short-term use, usually no longer than 2 to 3 weeks. Although cyclobenzaprine is affordable and effective for many people, it is not considered one of the strongest muscle relaxants, and it can cause side effects that may limit its use. Understanding cyclobenzaprine side effects can help patients use it safely and effectively. One of the most common side effects of cyclobenzaprine is drowsiness and fatigue. Taking cyclobenzaprine during the day may lead to excessive sleepiness, making it harder to stay productive, complete errands, or carry out daily responsibilities. Cyclobenzaprine is available in 5 mg, 7.5 mg, and 10 mg doses. For most patients, the standard prescription is 5 mg taken up to 3 times daily as needed. Higher doses, such as 10 mg, are more likely to cause drowsiness. If you find yourself unusually tired while taking cyclobenzaprine, consult your healthcare provider. They may recommend lowering your dose or adjusting the timing of your medication, such as taking it at night, to minimize daytime drowsiness. It is also important to avoid alcohol or sedative medications, including opioids, while taking cyclobenzaprine. Combining these substances can intensify drowsiness and increase safety risks. Another common cyclobenzaprine side effect is dry mouth, which can be especially noticeable in older adults. Dry mouth can make it difficult to chew, swallow, or even speak comfortably. Staying hydrated is essential. The Institute of Medicine recommends that adults aim for 11 to 15 cups of water daily. Remember that caffeinated or sugary drinks do not count toward this goal. To help manage dry mouth, try chewing ice chips, practicing good oral hygiene, or using sugar-free gum. Over-the-counter saliva substitutes, available as gels, sprays, or lozenges, can also provide relief. Headaches are another side effect that some people may experience while taking cyclobenzaprine. In many cases, headaches improve as the body adjusts to the medication. However, if they persist, your healthcare provider may recommend an over-the-counter pain reliever such as acetaminophen, Tylenol. Always check with your provider before combining medications. Upset stomach or nausea can occasionally occur with cyclobenzaprine. This side effect is less common but can still cause discomfort. Taking your dose with food can help reduce stomach irritation. If nausea develops, avoid spicy, fried, or high-fiber foods and stick to bland, easy-to-digest options such as bananas, rice, or toast. Over-the-counter remedies like Pepto-Bismol, Mylanta, or Tums may also help relieve symptoms. Cyclobenzaprine can also affect concentration and focus. Because the medication may cause drowsiness, some people notice it is harder to stay alert. When first starting cyclobenzaprine, it is best to avoid activities that require full attention, such as driving or operating heavy machinery, until you know how the medication affects you. This side effect can be more pronounced in older adults, people taking higher doses, or those combining cyclobenzaprine with alcohol or other sedating medications. Although rare, one of the more serious cyclobenzaprine side effects involves heart rhythm changes. Fewer than 1% of patients taking the 10 mg dose in clinical trials reported this issue, but it remains an important risk to understand. Older adults are at higher risk, and those over 65 are generally started at the lowest possible dose of 5 mg. Cyclobenzaprine is not recommended for people with certain pre-existing heart conditions. If you notice an irregular heartbeat, sudden dizziness, shortness of breath, or fainting while taking cyclobenzaprine, seek emergency medical attention immediately. These could be signs of a dangerous change in heart rhythm that requires urgent evaluation. Another rare but important cyclobenzaprine side effect is serotonin syndrome. This condition occurs when there is too much serotonin, a chemical messenger in the brain. While cyclobenzaprine alone has only a small effect on serotonin, combining it with other serotonin-boosting medications can raise the risk significantly. These include selective serotonin reuptake inhibitors, SSRIs, serotonin and norepinephrine reuptake inhibitors, SNRIs, triptans, and certain other antidepressants or migraine treatments. Mild serotonin syndrome symptoms may include a rapid heart rate, sweating, and difficulty sleeping. More severe cases can cause confusion, fever, agitation, and muscle stiffness. If you experience any of these symptoms, contact your healthcare provider immediately to discuss next steps. Most mild cyclobenzaprine side effects improve as your body adjusts. However, if your symptoms persist, worsen, or interfere with daily life, it's important to let your healthcare provider know. They may recommend lowering your dose or switching to another medication. There are also certain warning signs that require immediate emergency care. Seek medical attention right away if you experience seizures, an irregular heartbeat, severe drowsiness, hallucinations, or sudden shortness of breath. These may indicate that there is too much cyclobenzaprine in your system and that urgent care is needed. Bottom line, the most common cyclobenzaprine side effects include drowsiness, dry mouth, and headaches. Upset stomach and difficulty focusing are also frequently reported. While most of these effects are mild and temporary, there are rare but serious risks, such as heart rhythm disturbances and serotonin syndrome. If you notice any of these warning signs, contact your healthcare provider immediately to discuss the safest next steps. For more expert, science-backed health information you can trust, make sure to subscribe to HeInfo, your all-in-one destination for clear, reliable insights into medications, conditions, and safe treatment options.